speaker for today, Richard Gough, who is who's director at Soldiers of Shropshire Museum, who will be talking about health and safety in a nutshell. We'll have a look at health and safety law and duties for volunteer leaders, which I'm sure with the changes we are all facing as a result of COVID-19, a brief introduction will be useful to all of us. So welcome, Rich. Thank you for coming along today.
Thanks, Will. Yeah, I'll try and make it brief. The health and safety is a dull and dry topic, as you all know, and normally you start talking about it, the shutters go up, people disengage. What's really important about this, I noticed a few weeks ago in one of these afternoons, the discussion about risk assessments and bringing volunteers back. There were a few startled faces, and I can appreciate there are so many more volunteer leaders right now that are having to deal with health and safety issues and risk assessments. Never had to do it before, and it's always been someone else's role, or you've had it sort of done for you. So I just wanted a very light touch session now, just to explain the basics. I'm very happy in a future session or a separate session from this, if people are interested to look at, getting some help doing risk assessments or other bits and pieces. I'm happy to do that over Zoom at a later date, but we won't delve too deeply now. Let me just struggle with the technology and see if I can share my screen. Someone will have to tell me whether it works or not.
Yep.
Is it all nice and cool?
Yeah.
So it's all working. That's amazing. Okay, so yeah, health and safety in a nutshell. I think your responsibility as a volunteer manager, a volunteer wrangler, means that you take huge care of your volunteers, but actually the Health and Safety at Work Act doesn't make very much specific provision for volunteers outside what we would call a workforce when it comes to health and safety. So there's a few things I wanted to sort of clarify this afternoon. The first is a little bit of terminology. When we talk about health and safety, we talk about risk. Risk is always the chance of something bad happening. It's never something nice. In health and safety, it's always something bad. Hazard is something that can cause harm, and that could be a thing, an activity, an environment, an act, anything that can cause harm. You'll see reasonably practicable written together. It's the only time you see those two words anywhere else, is they're together, and it means a level of response that's relative to hazard and risk. So, for example, if you had a wobbly paving stone, you wouldn't be expected to lavish millions of pounds on it getting it fixed. But if you had a bare electrical wire behind a light switch, you'd have to do something about it immediately and pay anything to get that done, because the level of risk is higher. When we talk about workforce, we're talking about paid, unpaid, voluntary, any contractor, anyone that's doing anything that looks, smells, or sounds like work. You won't find the health and safety terminology referring to workforce. It normally just refers to employees. So we're going to use workforce today because it's more helpful to think about all of these people at once. And another word we'll use later on, suitable and sufficient, which is just enough when it comes to the acts that you undertake. Just enough to make something comprehensive and a balance of that and being usable and understandable. Like I said earlier, if you overcomplicate things and force it on people, the shutters go up. They won't engage. So suitable and sufficient refers to it being comprehensive enough to cover everything, but also user-friendly. Two key acts we're talking about today. We are talking about the Health and Safety at Work, etc. Act 1974. Notice how poetic and lyrical these acts all are. Shortened to HASAW or HASAW. And the management regulations, or the Management of Health and Safety at Work regulations, 1999. The Health and Safety at Work Act has its origins in the Children's Act, when it was decided that it wasn't worth risking kids' lives in mills during the Industrial Revolution. It evolved into Factories Act, and in 1974 it combined a lot of those acts together when it realised that not everyone worked in factories or in industrial environments and that there are different workplaces. So it brought all of those sort of into bear. The management regulations talk about how we deploy the Health and Safety at Work Act on the ground, what we have to actually do. It responds to and stems from the Health and Safety at Work Act, but it also aligns us with broader laws and other EU regulations. The only purpose of these acts is to reduce workplace hazard, protect lives and promote workers' health. That's all it is. It's not to create extra paperwork. It's not to stop people doing things that they think they've got common sense for. It's not to make money out of fines. It's only to stop people dying in the workplace or out of the workplace because of war. From a safety point of view, it's to prevent injury or loss of life in the workplace through accidents. And from a health point of view, which people often forget, is to prevent illnesses resulting from the work you do. 200 people die every year, over 1 million are injured annually. So we still haven't quite got it right, but that's a lot better in terms of statistics than some other countries. But what's missing from that picture is that there are hundreds of thousands of people dying every year from work-related illnesses. Normally, this is from unregulated workplace conditions in the 60s and 70s that are now presenting themselves as respiratory illnesses and horrible cancers. So we've got to remember the health in the health and safety market. In a nutshell, and again, these are sort of my interpretations of the law, the Health and Safety at Work Act says you must put in place the structures and measures to protect your workforce and others from harm and illness. That's your duty as an employer or as an organisation. There's no contractual inference can be taken from the law. You don't have to employ people in order to carry these duties. Your workforce, on the other hand, must carry out their duties within these structures. So they must do as they're told and be mindful of the impact of their work on other people. Finally, you must put in place a system for your workforce to report concerns, ask questions, and have that communication. More than 5 employees or more than 5 in your workforce, you should write a health and safety policy, or you should get a competent person to do so, and you should write your risk assessment down as well. Now, it's interesting in the law, it talks about employees as opposed to volunteers, because it would be interpreted that employees have a contract of employment and therefore are mandated to carry out work which might carry risks. And also, therefore, that contract implies that they understand and can be bound to other laws. It would be quite difficult to do that with a volunteer because they don't have that contractual obligation. However, and this is where you end up in a bit of a rabbit hole, a bit of a loop. If you've got to put all the structures in place to protect all of your workforce, and the duties on employees are to protect everyone else, then by virtue of that, they are protecting your volunteers. If your workforce consists solely of volunteers, then you have a duty to protect them, and they have a duty to protect you, and you have a duty to protect them, and so on and so forth. And we bounce between these first two sort of issues from the law. So volunteers are fully protected by health and safety law. The NCVO have a really good entry on their website, if you're a member of that, about volunteers and the law when it comes to health and safety, much more sensibly and succinctly than I could. The management regulations, as we mentioned earlier, you must make all suitable and sufficient risk assessments for all areas of your work. You must share the outcomes with your workforce, not necessarily all of the risk assessments, but certainly all of the outcomes. So if there's any training needed, if there's any guidance, if there's any messages, signage or anything else, you must share that. You must appoint competent persons to carry out health and safety duties, including training and monitoring. This is horses for courses. If you've got a massive organisation with a really wide spread of very risky things, you need to get someone who is completely up to their eyeballs in IOSH and NEBOSH qualifications. If you're a smaller organisation with very low risk activities, a management IOSH qualification, which is an online course, will be sufficient for you to be you also must have plans in place to deal with serious and imminent danger and emergency situations, including the impact of an emergency situation in your organisation on neighbours and neighbouring organisations. So if something big went wrong, you need to have something written down to say how you're going to stop it from spreading to other places. And you also need arrangements in place to cover all other health and safety issues. That's things like first aid, fire safety, and evacuation. But this is where it also blends quite a lot into HR. So it's things like provision of potable water, toilet and refreshment facilities, fresh air and ventilation, and regular breaks and things. So that all sort of ties up at the end there. And quite often people talk about why you should do this. Well, the first one is legal. It's the law. It's a very powerful law, a powerful act of Parliament throughout all of the. There are fines and sometimes prison for breaches and ignorance of the law. Secondly is financial. Not only do we have the fines that I just mentioned, but also you are at risk of uninsured losses. If your business goes out of action because you've been closed by the health and safety executive, your insurance company will not cover that as a business interruption loss. You could also lose reputation, which means that your business could suffer because people don't deem you safe. And finally, moral, which for me, from a volunteering perspective as well, is the most compelling reason why you should carry out your duties under the Act. Is you've got to keep these people safe. We do that much more naturally, I think, looking after volunteers than other HR people and other managers that I've met in the business. Our moral obligation to keep everyone safe is right at the top of our list of reasons why we do this. And it's a very, very powerful way of encouraging other people to take all of this very seriously. There are a few other links. Health and Safety Executive website is really comprehensive. Got loads and loads of stuff on there, myth busting and everything else. And it's not a difficult website to find your way around. As I mentioned, knowhow.ncvo.org.uk has a lot of health and safety and volunteering stuff. It's members only. It was free just until recently. And ROSPA talks about volunteer drivers. If any volunteers doing any driving duties, ROSPA can give you the details of that. Right, so I'm going to stop sharing now. I'm happy to take a couple of questions if anyone's still awake. And if not, if anyone's having trouble with doing risk assessments, especially COVID risk assessments, I'm happy to share at a later date. If people want to book something in or have a chat to me offline, I'm happy to do that.
Brilliant. Thank you, Rich. Thank you for sharing your expertise today in that introduction to health and safety. If there are any questions which you want to ask Rich, please ask now. We do have one question in around where would freelancers stand within that? Would they be, whilst under contract, would they be classed as workforce?
Yes, absolutely. You have to keep everybody in your environment safe, and whether it's a worker, a visitor, an invited guest, a trustee, whoever, you've got to put everything in place to keep them safe. So yes, they're covered by that duty, but they will also, if they are paid, it's implied that there is a contractual agreement there, and you have to do everything to make sure they understand what you have in place and what their duties are. In my experience, when we had contractors visit site to carry out any work, we do a very brief site induction to give them an idea. That's our end of the bargain, and they have their own rules and regulations for how they work. But definitely freelancers, you should give them the same introduction and induction for safety as anybody else. Anyone that looks like they're doing work, smells like they're doing work, or sounds like they're doing work is covered.
Great, thank you, Rich. As you just mentioned then around COVID risk assessments, was there anything you wanted to share specifically around any tips around COVID risk assessments?
There are two big tips I would give anyone about any risk assessment. The first one is that don't think that when you're writing a risk assessment, you've got to identify the risk and find a solution immediately. The first tip I would give for writing any risk assessment is just identify the risks, just list the risks. Don't just pick the ones you know you can solve easily. That's not the point of this. First thing is just identify the risks. Your standard risk assessment form, and I know there are lots of templates, should say, the first line should say, who is at risk and why? or what is the risk and who can be affected. That's the really important bit to identify it. And the second tip is that when you're outlining the things you're going to do or the things you have in place to mitigate these risks, you should always aim for collective safety over individual safety. We talked a lot in COVID about PPE. Personal protective equipment only protects that person. And it's way down the bottom of the list of control measures in a normal risk assessment. Collective safety means stopping the accident or the incident or the risk or the hazard from happening in the first place, and then reducing its impact on human beings on what's called a hierarchy of control. So always think about what you could do to reduce the risk of the thing happening first, and then how that might impact all the way down. So they're the two big tips for that. And think outside the box a little bit with COVID risk assessments, because one of the biggest risks I found when looking at our staff was their habits. And that's not something you'd find in a normal sort of standard risk assessment, is people's habitual behaviour and what it does and how you break that cycle. So that's, from a COVID point of view, that was the one that was quite tricky, and then has been stolen from me by lots of other people. Michelle, yep, I will. I'll drop you an email and we can arrange to have a chat about that offline later on.
We've got a question coming in from Rob. Rob, did you want to ask a question?
Yeah, I can do it that way. It was to everyone, really. Hello. Thank you, Rich. That was the most engaging and entertaining presentation on health and safety I think I've ever seen. It was just, I was talking to a group in Australia this morning, and they've obviously just coming out of their winter and into the spring, and they were saying how some of their volunteers, in some contexts, if they were returning to volunteer, had been required to either have a flu shot, because obviously we're all being encouraged to have a flu vaccination ahead of the winter season to ease the pressure on the NHS, and or have been required to also download their equivalent of our new track and trace app, at least in England and Wales, it's a new app. I was wondering if anybody's thinking about putting in place similar requirements or suggestions to volunteer as they return, that the volunteers should be getting a flu shot and or should be having the app on them in order to try and prevent the spread of COVID and reduce the risk of volunteers contracting stuff. Thanks, Rob.
Thanks, Rob. That's an interesting question. If anyone else does have an answer and wants to share their perspective, we would be interested to hear. From my perspective, before we postponed our reopening of the museum, we were going to be collecting the contact information from our volunteers when they come in, as in the normal signing procedure, as per the requirements to collect any volunteers or staff on site during the day. Recording entry and departure time, so that we could provide any data as required within the guidelines of GDPR. I'd be interested, particularly from anyone who's brought back volunteers. I see from Matt's comment that they did discuss flu shots for volunteers coming back. And I imagine with the potential delay in flu shots as well in the UK, there's potentially an issue around that point as well. Rich, did you have any plans around those sort of requirements when you brought back volunteers?
No, we didn't. I'm looking at what we've got ahead of us in the winter period, and I think anybody who's entitled to a flu jab, I would always encourage to do so. At the moment, we have volunteers, one volunteer per day, so that we've really reduced the risk of contact down immensely. So it's not as much of an issue, but we are starting to ramp that up. What I would say to everyone, and this is a conversation I was picking up yesterday from somebody very high up in AIM. Everyone in that side of things is expecting there to be a 2-week lockdown over half term, which will affect museums and heritage sites. So I would urge everyone not to invest heavily in half term activities. Keep their eye on the ball for that. So it might be that interrupts any winter illnesses or anything else as much as it does COVID. In Interesting though, yeah.
Thank you, Rich. Gemma, I saw you raised a hand. Did you want to come in?
Yeah, it was just to kind of echo what you were saying, Will, really. As far as our volunteers are concerned, we've been really quite strict on ensuring that they book in on we've got a volunteer management system, so they book in for their shifts. We have in the past on occasion had issues where volunteers have just fancied popping along for the day to come in because they've had nothing else to do. So we've really been actively discouraging that and saying that effectively if you're not booked in, then you're not coming in, and that's linked into us then being able to supply details should we be contacted by NHS, so we can effectively pass that information on. We've also been quite clear. I mean, obviously we're able to do this at our IWM sites where we have different entry and exit points for our staff and volunteers, so we've really been able to kind of segregate that and have sort of monitoring systems on who is entering and exiting the buildings as well. So I think that's helped to enable us to keep a log of who we've got on site at one time. But thank you as well, Richard, for the heads up about half term, because that's already been under discussion about us not delving too much into our activities.
Great, thank you. And just in case any of you are not aware, Richard just put in the chat a link so you can create your own QR code, which is part of the track and trace system. You can sign up your organisation or multiple sites so that people can scan the NHS COVID-19 app. So as part of the track and trace system, the link is in there. We will be saving a chat. So if you do need it, please let us know. But you also can find it on government websites, both in England and in Wales. And there's a separate app for Scotland, I believe. Correct me if I am wrong.